Hi everyone, welcome to Women's Health Tech Wednesday. I'm your host today. My name is Vandana. I'm Assistant Director for Research at HitLab. And before we get started, I have a couple of quick announcements to make. We have our Fall Innovators Summit in December, and tickets are now on sale. So you can scan the QR code or link will be provided in chat. In addition, there's our Fall 2024 BTA Challenge, which is live. So please submit your application soon if you have some innovative solution. And lastly, we also have our Women's Health Tech Challenge, so make sure that you apply before September 3rd. Without further ado, I would like to introduce our guest today, Alice Chung, Senior Analytics Manager and Cross-Portfolio Medical Insights Lead at Genentech. So, hi Alice, thank you for joining us today. Why don't you start with giving us a brief background on yourself?
Thank you so much. Hi, everybody. My name is Alice Chung. I am currently a member of Genentech's business operations team in the areas of strategic analytics and intelligence. I lead science and clinical analytics efforts and collaborate with many of our cross-functional stakeholders, including medical and field medical teams, to design and implement sustainable business strategies using analytics for oncology, immunology, ophthalmology, as well as pipeline products. My background is diverse, where I have extensive experience in long-term strategy formulation, scenario planning, program design, and embed analytics use throughout. Since 2006, I've been invited to numerous industry conferences from analytics, AI, innovations to share best practices for the use of advanced technology and analytics in general. I'm also part of the Global Innovation Management Institute, advocating the practice of innovation and mentoring others who are interested in this discipline. I'm glad to be here as the first time partnering with HitLab's Women's Technology Series. Thank you for having me.
Awesome. No, the pleasure is ours. Thank you. So, Alice, could you share a little bit more about your journey and specifically how your background has prepared yourself for this role at Genentech?
Sure. Thanks for the question. So I started my career in accounting, finance, and later on in consulting before I joined Genentech and Roche in various roles. My journey and background has always been in the healthcare and life sciences industry, which helped me understand different aspects of the molecule life cycle, patient journey, and later on learning different therapeutic areas in depth. I think the journey that I've had, I always have to utilize different data to make decisions, help others to craft strategies and tactics, and measure the results and impact to determine what needs to be changed with a continuous iteration approach. So when it comes to data and analysis, the most important piece is understanding the context. In fact, I would say much greater in the medical spaces than in any other regular analysis that just looked at quantitative data sets in order to be effective.
Well, definitely, that's awesome. And we're curious to understand, like, what sparked your interest in women's health? Like, was there any previous experience that influenced this approach? So how did it all begin?
Sure. My interest in women's health comes from 20 years ago when I first moved over to the Bay Area from Boston. It was personal at first because when I moved cross country, I was looking for a good provider who knew women's health, as women's needs are different. The concept of women's health was not that prominent, and also only in academic hospitals have greater specialization. So, so that's one aspect. And then the other aspect is, looking at around my mom, grandmom, aunts, friends, they all have different levels of needs, and there weren't always great ways to answer women's health related questions. So that sparks my interest in paying more attention to women's health. Now, from a work perspective, healthcare costs threaten women's health and economic security. And women are more likely than men to require healthcare throughout their lives. Statistically, they live a bit longer, just in a very generic term. Women are more likely to have chronic conditions that require ongoing medical treatment. And beyond reproductive and menopause, women with different races, ethnicities, living styles also have different needs, but these needs are not well understood, misdiagnosed, me included, and frankly speaking, still don't have enough attention that require greater efficacy. So Leveraging venues like this to bring this need out more and increase awareness in the public, I think it's important.
I totally agree. Yeah. When we relate to something very closely and we have the intent and all the purpose and reason to make a change, plus the right skill set and, right experience to bring about that change, I think that's a fantastic combination. So definitely we should, proceed and try to improve it for better. So that's awesome. So how has your, experience been within women health, like within your current role at Genentech?
Well, from a day-to-day work, Roche and Genentech do have existing and new treatments across different therapeutic areas supporting women. So my current responsibility is being a strategic thought partner in helping our medical teams, field and home office in an integrated fashion answer questions utilizing data. A lot of my work in the medical space is really being the translator of what the data says versus identifying the true nugget to help make informed decisions, as medicines requires a lot more contextual components than these should be interpreted. And being a cross-portfolio analyst, I would say you see patterns and different practices with data that could help spark different conversations to figure out how to solve the problems at hand. So I think that is one aspect that I could continue to learn more. I'm still learning as much as I've been in this role for some time. To do better at helping to solve some of these more hard to get questions.
Mm-hmm. Yeah, yeah. No, that's awesome. Data is increasingly becoming the key to, success within healthcare, right? Because as they say, if you cannot measure something, you cannot improve it. So you need to study the data to measure something, how the status is. Okay, fantastic. And how do you like stay on top of emerging trends or innovations in research and analytics?
Well, probably like many others, I receive lots of emails and reports associated with emerging topics. When I come across interesting website, I myself will just go sign up to receive more. But I think the important piece is not so much around how much you've signed up. It's more about dedicating time to read, finding time to internalize what you have learned, and also it's essential to figure out how do you bring some of those new knowledge and emerging trends into the practices, small pilots, discovery analysis, exploratory effort to help and really understand what does that mean with the problem you're trying to solve and what does it mean when it requires additional monitoring or additional data sets and so on and so forth. I think more importantly, staying connected to science and being involved in key conferences also helps spark a lot of emerging trends and discussions with industry peers, just to have an outside-in perspective, because that will make your view much more comprehensive.
Right.
And that would be kind of how I stay on top of emerging trends and innovations through learning, through discussion, as well as through practicing.
Right. No, definitely. Yeah, as the saying goes, a brief talk with the right person across the table is sometimes more useful than reading 100 books. So yeah, as an industry, there are different perspectives to women health. So the more diverse perspectives are brought to table, the better overall comprehensive understanding. So totally agree with that. And have you been involved in any sort of initiatives that have, contributed to advancing knowledge or some treatment options in women health or in general healthcare?
So as mentioned before, in my day-to-day, I do serve as strategic thought partners to help our medical field teams to advance their work in translating medicines to patients. But I think, one thing to plug here, our Genentech and Roche have a broader and strong commitments to women's health. We have X projects focusing on commitments and initiatives to this specific areas and also conducting more research to understand women's need, even including existing therapeutic areas. We also have the Love Letter campaign bringing a multicultural cancer screening awareness, focusing on improving cancer outcomes for women of color. So I would recommend for those of you that are interested, go take a look at our website. It's all public information. That could be a useful resource to understand women's need if you want to be involved, you can also figure out how to get involved. Um, Particular the information provided on the website. But I think from my day-to-day perspective, I get involved with a lot of different activities, and that each of the building blocks helps advance the translating of medicines to patients. So that will be my contributions, let alone some big efforts.
Wow, I love the love letter campaign that you mentioned. Definitely, when you are heard and when you're included, it's very rewarding. And you can just express what your experiences have been and contribute significantly to research. So that's wonderful that you take into that perspective. Amazing. And then you also talked about, how you collaborate with different groups and departments. So can you maybe describe a time when you successfully partnered across different disciplines or departments to sort of drive an analytics project forward?
Sure. I collab with cross-functional teams all the time in my daily work as a strategic thought partner. And everybody has a different roles, and everybody comes with their different expertise. To collaborate successfully, I think it's really to understand the strength that each of the cross-functional partners are able to bring to the table, and also offer ways to stay flexible yet focused in achieving the outcome. Analytic projects require change management, and sometimes this is often missed because change management will help folks, both collaborators as well as users, to understand the context, problems we're trying to solve, the why, and trusting the number and the data. And even though it's an objective way of looking at it, sometimes it may not be perfect and it requires ongoing feedback and improvements to do so. So I think those are critical elements. And the last one that I think is also helpful is to continue to build the relationships in the people that you work with so that it can help drive analytic projects and even any projects forward. So that will be kind of how I work with my collaborators.
Fantastic. Well, talking of people and talking of how do we maintain or improve those interpersonal relationships. So how do you tailor your communication of analytical findings to sort of ensure that they resonate with different stakeholders, even including the non-technical audiences?
Yeah, that's a great question. Sometimes the work is easy, but working through people and with people are not always easy. So I think understanding their styles, this will help. I think for non-technical audiences, I tend to anchor more around explaining the context and also providing supporting facts and actual examples of what this will work or what it has worked is important, because I think theoretical information sometimes doesn't help people to relate. For more technical folks, it's just to be prepared and explain at times very specific instructions or details, implications. Sometimes learning their language and try to speak their language will help. And also allow time throughout the involvement that you have to have healthy debates based on the status of the efforts, and not being afraid to have conflicts when folks are asking challenging questions. And I think my role as the lead, having certain level of credibility, is also important to help managing different expectations. So these are all related to communication and also soft skills. And I think finding that right interpersonal nonverbal cues, if you're able to see them, and building relationships along the way, and even when there are differences in opinions, will go a long way, because I think we need to assume good intent, but sometimes different styles might get in the way, but we just really need to look at it in a more objective ways and not taking things personally. I think that will be all the component that needs to be considered in communication and soft skill interpersonal front.
Right, absolutely. Yeah. Well, as you mentioned, analyzing the data and getting to the findings is a considerable part of the journey. But then taking those findings to the beneficiaries and making them understand what is this, why we have done this, and how it can actually empower some decision making for you, or just give you a better view of your healthcare and future prospects. That's also a very significant part of the journey, or a role of a researcher in the field. So I'm really glad to hear what you're doing. It's fantastic. And talking of a lot of data analysis and in the women health perspective, so in your opinion, what are some of the key data challenges that is unique to the field of women's health that you would have encountered or come across? And if you did, then how you address those challenges in this role or previous roles?
Yeah. To me, data availability, completeness, timeliness, and quality are always the challenge. And this is not always understood because sometimes it takes more time to get the data ready than to perform the analysis in order for you, even as an analyst, to trust what you're saying. So if there are ways to address some concrete data issues, then great. Otherwise, it's really understanding different alternative solutions or managing expectations and what your analysis can or cannot answer to help manage expectations. I think women's health in particular, I still find a lot of different data sources being very disparate, and they are in different pockets. So it really requires strong knowledge to bring everything together and make sense before you can do further automations or scaling, because a lot of new technologies will help advance and speed things up, but it also requires more human in the loop to make it work. So those are the continuous data challenges we have to overcome as analysts. And I think the thing is, you want to be very focused around what set of data can help answer questions versus bringing everything and then creates a lot of noise. And that's a very fine balance you need to strike.
Right. Yeah, I mean, I can imagine that softwares or automation can tackle numerical calculation or some sort of scenarios they are trained on. But then where human expertise come in is where you have to fit it with world scenarios, or give it the right context, or just introduce some constraints that happen while collecting the data that the system is not used to and it just knew. So yeah, definitely some expert analysis and overview of things is crucial for the success. So thank you for explaining that in detail. And then my next question would be, how do you prioritize and manage multiple analytics projects simultaneously? Because we can imagine you would be super busy, and especially when they are sort of sophisticated enough and involving diverse aspects of health, medical insights across, let's say, different portfolios. So how do you do it?
So just like project management, also I am also a practitioner of program project manager on analytics front. I think you forecast, you plan, you obtain alignment on the workload, and you prioritize accordingly with the highest impact. For example, how long an analysis will typically take to complete on the problems you're trying to solve. You should have a good idea what it will look like. You also need to understand when there are new projects coming in, what activities need to be dependent upon. Is it data availability? Is it technical teams help? Is it research need? And there are a lot of different components to it, as well as what analysis can be done in parallel or in sequential in order to complete a comprehensive analysis that's helpful and impactful to answer the questions. I think it's a continuous balance, and I think I've supported medical, and I'm still learning given the diverse aspects of health and medical insights across different portfolios. So it's never a dull moment, and I would just say, as you are working through and helping others to work through a lot of this kind of analytic projects, the more you also help bring people along, the more we're able to solve problems at hand. So it's not just expecting an analyst know what to do. Everybody, the more they know, the more they get familiar with different data sets, the more they are understanding the comfort and interpreting, it sparks different ideas. That also helps to prioritize different competing analytics projects to get to the highest impact effort.
Wow, I love how you described it. So, just not giving, instructions to the team members that you have to do this, that, but you actually make them understand what's your role, how you can be accountable to deliver as perfect work as possible, and how you can do your own research or equip them with best training and information. So that's fantastic. And that brings us to the last question for the session. What personally drives your passion for advancing women's health through analytics and medical insights?
My passion from a personal perspective, I have immediate family members not having great women's healthcare, and myself included, want to see this important healthcare needs advance further. And I think in a broader context, in so many different therapeutic areas, including clinical trials, women are still underserved patient population. They still are. Not enough data sets and evidences to be able to find like very targeted data for women. And so for our society, I think definitely more research, evidence generation efforts, and more effective treatments are needed tailoring to close some of the women healthcare gap needs, including associations with chronic diseases, access to care, socioeconomic determinants of health, and with more advances in these areas, then analytics and medical insights that we do can then help translate and understand why and identify opportunities to focus on to bring it more to patients. That's what our analytics professional can then do more. But some of its broader systemic contextual needs to further advance with more advocacy, with more awareness, in order to advance the overall good for women's health. So that's what I am hoping that my passion, the greater society's passion, and everyone else who's helping to advance women's health needs can help drive for the greater good.
That's incredible. And just as another part of that question, from me, just out of curiosity, what's your vision for women health in, let's say, next 10 years? Like, what do you want it to see as become more, how advanced do you envision it to be?
I'm going to speak with my 2 cents. This is Alice thinking with 2 cents. I think the advancement should be, key therapeutic area. There's enough of understanding of women's need and the triangulations of women's need with a lot more data, with a lot more evidences, with a lot more points of view around how women should be treated, should be taken care of. In the next 5 years, in medicine is still short. Is still short, even though we have a lot of advanced technologies, AI, machine learning, but it still requires a lot more evidence generations to make some of hypotheses or new findings solidified. So if you think about even COVID as an example, we're almost 5 years, right? It's still new data coming out. So I think women's health will also be similar in that regard, even though it's more well known. So I'm hoping that it has more advancements. We can see more information, treatments more tailored to women. That's what I'm hoping the next couple of years will be.
That's awesome. Well, thank you so much, Alice. I loved all the insights you shared with our audience, and we are very grateful to have you at our session today. Thank you so much for your time.
Thank you.
That brings us to the end of the session. I would like to thank everyone and request join us next time. A big thanks to all our sponsors. And again, one last thanks to our guest. So thank you, everyone. See you next week. Bye.